Hi everyone, welcome to the ANU Humanitarian Innovation Society's Health Innovation Hackathon Pitch Night on Fighting Pandemics, co-hosted by the Clinton Global Initiative University and IBM as part of the Call for Code Tech for Good series. My name is Catherine and I'm the ANU HISoc president and founder. It has been quite the incredible week, kickstarting with a weekend of workshops breaking down the issue of pandemic management into three major issues: strengthening healthcare capacity in developing communities, creating faster and more efficient resource allocation systems to get supplies and personnel to where they are needed, and innovating better technology that prevents or minimizes infection. This evening, our judging panel consists of representatives from the Clinton Global Initiative University, IBM, the ANU, Innovation ACT, and the Canberra Innovation Network, all of which share an immense wealth of knowledge between them. There has been so much engaging and meaningful conversation over this past week, with teams working incredibly hard over the 5-day design sprint gap. They've delivered some truly impeccable solution projects that work to address current gaps in pandemic management for communities close to their own hearts. So here are the pitches, and our team hopes that you find them as inspiring and as thought-provoking as we have.
Greetings. We at Black Mountain Solutions believe that HISoc is the next step in streamlining e-healthcare systems in developing countries. HISoc aims to do this by integrating local medical record platforms at the national level. From a report by the Kenyan Health Ministries, the automation of patient records through the use of electronic medical records will play a crucial role in supporting the realization of the National e-health strategy. As a result of the decentralization of the healthcare system in Kenya, there are a number of open source EMR systems, such as OpenMRS, used in a number of each of the 47 counties. Obtaining national statistics is a burdensome process for healthcare professionals who have to take time out of their working day to input this information into national databases and then extrapolate the results. HISoc's automated nationwide system works by compiling data from each of these open source EMR systems, which benefit healthcare professionals by allowing them to provide timely and high-quality care for all patients through providing accurate, up-to-date, and complete information about patients at the point of care, as well as supplying instantaneous access to patient records for more coordinated, efficient care, as well as providing a secure platform for this information to be shared, collecting nationwide data, which allows governments to efficiently tackle healthcare issues where it is most needed, helping healthcare providers improve productivity and work-life balance, and reducing costs through decreased paperwork, improved productivity, and the elimination of duplicate patient profiles in the EMR system. In addition, HISoc will accelerate the ability of governments and healthcare systems in the context of a pandemic by ensuring healthcare providers are working at productive capacity. And now for our concept. HISoc aims to improve the interoperability between medical data platforms in developing countries following initial trials in Kenya. Barriers to information and communication technologies, ICT, implementation include lack of infrastructure, inadequate funding, poor data systems, and lack of compatibility, coupled with lack of skilled personnel. From this, HISoc looks to improve the structural challenges faced in ICT integration, using robotic process automation, RPA, to automate the transfer of information between county-level platforms and the District Health Information Software, DHIS2. In doing so, we aim to eliminate the need for dedicated nurses in data entry roles, with the intent of incorporating IBM's blockchain information systems at a later date for added security. In developing our service, we adopted theories from the Technology Acceptance Model, TAM, in relation to integrating new systems in developing countries. TAM explains that perceived usefulness and perceived ease of use are the two most important factors to consider when designing technologies. As such, HISoc positions itself as a data sharing technology that improves the current systems at hand, which will be well received as it doesn't further convolute the technologies already in place, but rather improves their coexistence with one another. Figure 1 highlights how these EMR systems currently operate the handling of information between laboratory, pharmacy, HR, financial, and community systems. With each EMR system operating independently from one another, redundancies, misinformation, and outdated data are rife throughout the current DHIS2 system. There is potential for HISoc to expand into other areas of e-healthcare, which will be discussed to a greater degree under the heading Future Goals. Black Mountain Solutions shares a close affinity with Kenya, as Henry Jamble's father, a GP, has witnessed firsthand the red tape which hampers efficiency of its healthcare system. Kenya was also chosen as a test subject for HISoc, as it has undergone several developments in e-health infrastructure that will allow for HISoc to be implemented successfully. Following trials in Kenya, HISoc will look to expand to rural parts of Kenya and eventually other developing countries if proven to be successful. This will be ascertained through surveys and interviews with healthcare professionals and assessments of quantitative data. Upon forming a partnership with the Kenyan government and local stakeholders, as well as IBM, HISoc will be able to collate data from the numerous open source EMR systems within the country to deliver national statistics, as well as generating patient records seamlessly and in an accessible and standardized format. In addition, HISoc abides by Kenyan legislature. For example, in Kenya, government forms that require original hard copy forms make certain reports from the system unusable. Manual copies have to be filled out, stamped, etc. for physical delivery to relevant government offices. HISoc adheres to this by pre-filling the government forms with information from the EMR system, which can then be signed and submitted by doctors to government offices. Our future goals consist of looking to partner with IBM and integrating with their Watson Health AI system to allow us to capitalize on IBM's cutting-edge data collection and analysis technology and deliver valuable health insights for Kenya's population. This technology will also serve as beneficial for future pandemic and disease foresight, monitoring, and prevention. We intend to integrate with telehealth systems as well. As digital health infrastructure continues to be developed, HISoc is predicting that Kenya will transition to telehealth to combat the current difficulties regarding servicing the population. For this reason, HISoc will develop our software to be easily compatible with telehealth services to allow for a synonymous digital health service throughout Kenya. And we intend to develop Kenya's rural e-health infrastructure. Although Kenya has undergone consistent developments in e-health infrastructure throughout urban areas, a major limitation of adopting HISoc is the lack of developed infrastructure surrounding digital health in rural areas. For this reason, our team is looking to develop HISoc throughout Kenya, specifically in urban areas. From there, HISoc will look to attract foreign investors to enable us to expand our service to the more underdeveloped rural areas. We at Black Mountain Solutions thank you for listening to our presentation.
So we are the Disease Terminators, proudly presenting to you a solar-powered radio transmitter which can be used in Africa for malaria outbreaks. Hi everyone, so I'm Sylvia and I'm a current biomedical engineering student studying at UCIT, and I'll be presenting the problem as well as the target market of our solution. My fellow colleague Harry, who is a health science student studying at ANU, will be presenting our solution and its benefits. Malaria is a life-threatening disease that can be transmitted to humans through the bites of infected female mosquitoes. This disease can cause symptoms such as high fevers, chills, headaches, and nausea, and can cause chronic symptoms including seizures, kidney failures, and even death. According to the World Health Organization, or the WHO, in 2018 there were approximately 228 million cases of malaria worldwide, and Africa accounting for about 93% of these cases. In addition, there were about 405,000 deaths worldwide. The possible reason why Africa accounts for such a high number of cases could be due to a lack of awareness and education in the poorer regions. According to the WHO, regions with high cases of malaria have weak surveillance systems to monitor outbreaks and thus can make it difficult to effectively plan and respond to these outbreaks. So for our target market, we have decided to focus on the poorer regions of Africa and areas of Africa where malaria is prevalent because in 2018, as I mentioned before, Africa accounted for such a high number of cases of malaria. And also in 2010, there were 533,000 deaths, but in 2018 it significantly reduced to 380,000. Now this is still a quite high number, but it definitely has dropped, and we hope that by implementing our solution, we can further help prevent the outbreak of malaria and also help to reduce this number even more significantly over the years. So now I will pass on to Harry, who will discuss our solution.
Thank you, Sylvia. Here's our solution, a solar-powered streetlight with radio function. The radio antenna receives up-to-date and official information during malaria outbreak, which could help people take preventive action on time. Solar-powered LED streetlight is power efficient and could last for 3 days without sun during rainy season. The solar-powered radio speaker broadcasts hourly updates and health promotion programs to the public. The two-way talk button allows the user to communicate with local authorities to report outbreak and request assistance. It will be a proactive solution for strengthening the healthcare system in Africa during malaria and other disease outbreak. Considering the setup cost and use cost of this radio system is relatively cheap, thousands of units could be installed in rural villages in Africa to improve proximity. It is also easy to operate the radio, as the radio can be set to broadcast automatically. As the mobile network coverage is extremely limited in rural areas in Africa, providing up-to-date information via radio signal could be the most reliable means. This radio system also fits people's lifestyle, as a report from UN advised that Africans in remote regions are more inclined to listen to radio updates. In addition, this system improves the public lighting in remote African regions, making people feel safer in the evening. This system could also be used to broadcast health promotion and general knowledge programs to the public. Here is a budget estimation if we bring this project to the Democratic Republic of Congo, the country with second highest malaria prevalence. Firstly, as shown in the map, if there are no existing radio transmission towers, 18 towers are needed to cover the entire country, which will cost $360,000. Afterwards, we will set up the solar-powered radio streetlight in small rural villages with population less than 50,000. Around 1,220 radio streetlights are needed in 122 small villages in DRC. The estimate cost is around $122,000. Therefore, the estimated total cost of this project in DRC is around $482,000. This is our reference list. Thank you so much for your time.
Hi everyone, we are Team Doctor Now, and our idea helps strengthen the healthcare system in Vietnam. The recent outbreak of COVID-19 in Vietnam exposed some weaknesses in the country's healthcare system in dealing with a pandemic. Because there is a lack of an effective network of GPs, many people go directly to public hospitals for their health issues. This inefficiency creates big crowds in public hospitals and prolongs the time patients need to wait before they get to the right doctors. This was worsened during COVID-19 due to the lack of COVID testing clinics in the country. In one instance, one patient in Da Nang with COVID-like symptoms showed up at a few major hospitals for consultation and unknowingly spread the virus to other patients, healthcare workers, and the community before being tested positive. The consequence was that major hospitals became COVID clusters, exposing the most vulnerable patients to the virus and preventing non-COVID patients from getting treatments.
So let's go over the demo. So first let's fill out our profile. So we can enter let's enter our email and date of birth. Because this information is going to help the practitioners to diagnose our situation. Okay, looks good. Now let's look at the doctors. So here we have the list of the doctors. So since I'm not sure about my health profile, so let's just meet the GP, general practitioner. So let's book an appointment. So here we can see the agenda of the GP. So her name is Janet Andrew. She's a general practitioner, works in the Midway Hospital, and lives in Sydney, and 15 years of industrial experience. So today is 15th. And it looks like we can have the appointment on 18th. So let's book an appointment here. So let me just leave my email name and my phone number. So please call me. Okay. We can also see bi-weekly or daily or in agenda.
We chose the Vietnam market because it has a high potential to apply this technology and will benefit significantly from its application. The Vietnamese government recently released an app for contact tracing, which has since been downloaded by 14% of the population. This shows that the government is effective at public communication, but also that the population is quick to use new technology for healthcare reasons. Having high population density, as high as 4,500 people per square kilometre in Ho Chi Minh City, Vietnam would benefit greatly from this application by allowing patients, especially those with pre-existing conditions, to get preliminary medical help without exposing others or themselves to infectious disease. Apart from benefiting doctors and patients from the direct use of the app, the government will also benefit by obtaining data on common public health issues and behaviours. This can then be used in future to plan public health campaigns and resource allocation. We expect that this app will transform public health services in Vietnam.
The implementation is also an important part of our project. With the government's existing communication channels like TV and Internet, our intention is to have the Vietnamese government to develop the content and also to maintain, manage, and advertise our application. We also think it is important to use the government's credibility in public to attract and engage the big hospitals, general doctors, and medical school students to take part in our program. Besides that, we also need to work with pharmaceutical companies to provide affordable online medicine sale to the patients. And we expect the potential barrier for the adoption is the people's concern about their personal privacy and information security. We think the only way to solve this problem is to be transparent about how we process and store their personal data under the guidance of government.
Once the web application is implemented successfully in major cities in Vietnam, there is potential for it to be applied to the whole country and other developing countries with similar healthcare systems. I hope that you are as excited as we are about this idea. We believe that a simple idea, catered to the right community, and implemented effectively can have a huge impact. Thank you.
Areas only in 2 states in India itself. But of course, there's also an expectation.
Storm first touched down in the Indian state of West Bengal, the coastline there and neighbouring Bangladesh.
Until and all clear.
Imagine if you were in the middle of a pandemic and hit by a cyclone immediately following a flood. What you were told yesterday about your safety and your health had all been washed away in a matter of hours. What will you do? Similar disasters can happen anytime, any place. However, people are not aware of the seriousness of the situation. Neither are they aware of where to seek help or what help is out there.
Advocate aims to conduct programs to educate the public about health literacy, and once educated, advocate this message within their communities to create national-level changes in attitude and overall behaviour when it comes to facing crises and challenges. Advocate has a user-friendly website which reinstates our aims whilst also providing a platform to present our events.
Through our website, you can register for our monthly events in simple steps, free of charge. On our website, you can find infographics on prevention and management of health issues, updates on current local health issues, and an international scope on global health issues happening right now. If you've missed any of our events or would like to share them with others, Video recordings of our previous events can also be accessed on our website for everyone at any time. Our website also provides a platform for everyone to vote on health topics that they are most interested in or any health issues that concern them.
After booking into the events online, participants can attend and join the panel discussion on site. Our panel will consist of medical workers, public health workers, community members, and celebrities. We believe by including representatives from both the academic arena and the community, varied perspectives on how to reduce the gap in health literacy will be raised. With Advocate, we aim to empower our community through the delivery of knowledge that is easy for public uptake. By increasing health literacy, individuals will be more aware of when and where to access health service. Through this approach, the overall health outcome of the population will be improved, and therefore preparing and equip the population for the burden of disease or possible future pandemics.
We will be working closely with universities in Bangladesh and promote our events to youth as they are the leaders of the future. Our events will be funded through sponsorships, as well as working closely with NGOs including BRAC, Friendship, National Heart Foundation of Bangladesh, BBC World Service, and ICT Innovation Fund. Users can purchase the $2 membership monthly for Advocate. With membership, the users can access the video with special guests and engage in the panel through the exclusive Q&A sessions for our memberships. Our business is for non-profit. Other than the essential expenses associated with running our business activity, all revenue generated will be donated towards charity.
In terms of future directions, we plan to expand this idea into a TV program by partnering with a non-political channel so that more people can access the information more readily and therefore reach out to varying demographics. However, getting our newly made program into the TV schedule by partnering with a channel is tough if we do not have a platform created that will support our ideas. Therefore, establishing a platform by starting with a uni-level program is essential to being successful in the TV mass media.
We are a group of health and medical science students who come from diverse backgrounds and ethnicities. We believe we have the vision, from having lived through many of these challenges, to inspire education for health literacy in developing countries. Advocate aims to inspire, not just educate, because it builds on the unique culture and people of each nation. So we hope we've inspired you to join us in our mission to advocate.
This is Zhichao Tu from Team Go Baby Go. For this Health Innovation Hackathon 2020, we'd like to provide our ideas with SpeedX. Our chosen problem is track 2, creating faster and more efficient resource allocation system. And our goal is managing logistics to allocate crucial medical supplies and equipment efficiently for small business owners in pandemics. So here I'd like to introduce the SpeedX, an actionable all-in-one system with a delivery network management platform and a product ordering and tracking user interface. So let me introduce you the Wendy Ryder, who is come from Sydney. Her currently job is a grocery store owner. She still opened her store during the pandemic. She just registered for the COVID-safe business, in need of PPEs to protect employees and herself and maintain a disinfected environment. So we'd like to introduce Wendy to our front end, which is ordering and tracking UI. Just like shown, we can browsing some product informations and more detailed informations from the government here. After this, we can create a new account by scanning our QR code, which is related to the COVID-safe company. We can easily scan it and store the information. After registration, we can sign in and then browse our products. We can add them to the cart and then confirm our order. We can also track our orders use this trace function to see where did our orders go according to the map, and we can have an estimate time for that delivery. And then we can make some changes to our user informations. And once we get our users' information registered, then from the back end, our delivery network management platform can monitor the status, cover the demands, and to optimize the locations for the delivery. So here are some food and beverage business locations on the map, and we can get that from our users' registered location and also from other fields like grocery shops or post office or pharmacies or gas stations, whatever the COVID-safe business are. And then we can all have them on our maps at our point of interest. With these points, we can, based on our usable existing delivery warehouses, we can recommend warehouses and their size based on the demands. And hence we can generate a warehouse service scope within 1 kilometer, which is a quite achievable distance. And then we can recommend more warehouses based on the growth of our users. And then we can generate a wider service scope, also within 1 kilometer, to serve more and more business owners. And this platform, we think of it as a reusable and scalable, since it can be continuously used after the pandemic situation for efficient delivery, and it can also be expanded to a variety of cities and fields. And that's it for our SpeedX presentation. And thank you from our team Go Baby Go.
Hello everyone, we are from Team ZoomInLive, and today I'll be talking to you about our application. My teammates are myself, Rupini, Celine, Kay, and Fem. We have identified a few problems in the current healthcare system. First is inefficient and non-centralized booking system. This is because most hospitals have their own booking system and they are often unreliable. The most easiest way for customers to book an appointment is usually through calling, which can be very inconvenient. So customers usually tend to not book in advance and go directly to the hospitals, which results in long waiting times as they do not know how full is each hospital. And then in addition, customers also do not know which hospitals are famous for what kind of treatment, resulting them unsure which hospital to go. So what our app solves is that we have a centralized booking system where customers can see the list of hospitals in their area and the specialty of each hospital. This will result in shorter waiting time. So customers can go to the hospital which is suitable for their specific needs. Yeah. Now I'll just talk to you about the business model that we have come up with. What we want to do is a sponsorship based model for the first 2 years. So we will rely on a grant provided by funds who cater to medical innovation. So we'll only focus on public hospitals. Once our app is popular enough, maybe in 2 to 3 years, we will expand it to private hospitals and we can charge them a yearly subscription plan. This will also benefit the private hospitals as they will be in our app so that our customers who will be loyal to us will also consider going to the private hospitals for their specialized treatment. Now I will pass it on to my teammate Kate to show you our prototype demonstration and also talk about the design and also implementation.
Thank you, Rupini. So as you can see, this will be the first screen that greets the users. When the users click the blue arrow, it will identify the user's current location, and the red pins here identify the hospitals nearby. So by clicking each red pin, the users can see which hospital is located there and its respective occupancy. So users can easily click all the red pins nearby and compare their occupancy and decide which hospital to go to. And when the users click the hospital, the app will show more details for the hospital. For example, we have operating hours, the tags. We will update the facilities that each hospital owns as tags and also the specialized treatment that they offer. We also have the address and the phone number where the users can easily click the button on it. For example, the location will lead to the Google Map, where the messaging and calling button will lead to the messaging screen and phone calling screen. When the users click book an appointment, the users will be required to fill in the form asking for basic information such as name, age, and the emergency situation. We have some instructions here for the users to rate their own emergency situations. Then we also allow users to share their location to the hospital by enabling location sharing. Users can also choose their desired appointment time, be it immediate or in future, in months later, or in days later, weeks later. So we also have a chat panel where the users can have conversation with the medical staff regarding emergency, if they need emergency help. And also we also have an appointment tab for the users to look at the appointment that they have made, which acts as a reminder. So it's obvious to see that the app has a very intuitive UI. It's easy to use because this app caters to all age groups, so it's really important to make it easy to use. And next, it's also feasible. We can easily plug it into the hospital current system, so the medical staff don't have to do so much work. So we hope that you have fun listening to our idea, and please feel free to scan the QR code on your phone and have a play around on the app. Thank you so much.
Hi, my name is Sophie, and on behalf of my team, I would like to introduce you to the innovation called Easylist, which is a new perspective on contact tracing. So we're addressing the call to innovate a better technology to prevent or minimize infection. And so what is the problem? We looked into the technology of contact tracing, and we wondered why GPS-based contact tracing apps were not as popular. So we investigated this by surveying a sample of 70 people, and we found 3 underlying problems. 1, the majority of the sample would rather an alternative to sharing GPS data. 2, the majority of people remember where they've been, but not at the exact time, and so that's one of the gaps we're trying to meet. And 3, not all the places that have an alternative to contact tracing offer it. So, for example, supermarkets and takeaway stores do not offer an alternative to contact tracing, but like cafes and restaurants have like little sign-in sheets. So we have identified the need for a convenient tracking method that doesn't have invasion of GPS privacy, but it also has to be compatible for high traffic areas. So our solution is called Easylist, a contact tracing alternative that utilizes RFID tags. So what we're doing is we're integrating the technology of our phones that have been able to read RFID tags, and these tags are going to be in different locations. So the app then reads the tag at the location and writes this data down in a personal list along with what time you scanned it. This is an alternative to GPS data sharing. It is implementable as an app, and importantly, it's a record of where you've been for contact tracing. This technology currently exists. If you may see some apps on your phone for reading RFID tags. So all we need to do is implement it to this scenario. So my team member Charlotte has created a prototype. So I would like to what the app would look like and some of the key features. So if you feel free to go to this link below as well to investigate the app, but right now I'd like to point out some key features. So when you sign in to Easylist, notice when you sign in that you're requested to say what state you're from. This is because each different state in the country has different health regulations. So when you sign in, you'll be asked to scan a tag. And so once you scan a tag, the time and the location is going to be listed. So once you hit continue, you have access to show my list. So in show my list, you can see in today, that tag is in a list ready for your day. But also, if you want to see what other places you've been in the past fortnight, for example, yesterday, you might see that you went to different places and you can scan and remember where you've been over time. So, what is the impact of these alternatives? One, it increases the possible locations for tracing. For example, supermarkets and takeaway stores can have these RFID tags, so the person can scan it as they walk through, because manual sign-in is not possible. Two, it increases the accuracy of contact tracing because now we've covered a larger group of businesses, locations, and most importantly, people. And three, it promotes awareness and initiative for people to be more responsible for their health and well-being when they're going out. And four, it introduces a competitor to sharing GPS data collection methods. So this means apps can now try out different methods of collecting data. So what do we need to make this innovation work? As seen in this flowchart, from left to right, we need the following 5 things. Firstly, we need an expert in RFID technology. We need to further brainstorm the feasibility of this idea. If this is feasible, we'll then need a team for a startup. So that includes project managers and developers to develop the app and technology. The next step is a trial phase. This may look like rolling out the app and the RFID tags as a prototype in Canberra to see how it's received by the public. And after prototyping and testing, if the project's still successful, we can distribute and promote this app on a national basis. We would especially like to partner with the government health officials because they will need this data for contact tracing. And also lastly, we'll need a team to maintain the system over time. As the pandemic will change over time, so will the needs of the people and the app. So Easylist will challenge how we think about contact tracing, and we hope this is a step forward in controlling the pandemic. So thank you for listening. If you're interested or you have any feedback, please do not hesitate to contact us. If you like the prototype and you're interested in the demo, please especially contact Charlotte. Thank you for listening.
Since the beginning of the COVID-19 pandemic, we have witnessed a sharp rise in the demand for PPEs. And now, as this pandemic continues to affect Australia, it is more important than ever to take precautions and protect ourselves and our communities. However, with so many varieties of masks and PPEs out there, how do we, as the public, know which kind to use? And how do we make sure our health professionals have adequate access? And how do we know the PPE we receive is actually effective? The current pandemic has drawn attention to the lack of consistent and reliable access to adequate PPE across Australia. We intend for our app to be a part of the solution in protecting our communities against COVID-19 by providing adequate access to quality PPE, as well as general information about this current pandemic.
We have divided the users of our app into 3 demographics and assessed their needs in accordance with our goal of improving the efficiency and effectiveness of PPE distribution and disease information. PPE suppliers need to be able to access consumer information, particularly from health professionals, while also the latest information on national guidelines regarding medical equipment. Health professionals include hospitals, medical clinics, and aged care residencies. They are the most important users of PPE and thus are placed to prioritize. The general public is our largest demographic. The focus is on the need for an accessible and easy to understand central of information regarding restrictions, hygiene, and case hotspots. While there is an increased access to standardized PPE, this is limited in accordance with the needs of health professionals.
Our team aims to develop an app that allows both healthcare professionals and households to have access to quality PPE. First-time users have the opportunity to select their preferred language from a list. The app then directs to an Australian state selection, which will allow for us to match the user to PPE suppliers. Users will complete specialized surveys in order for us to gather data and make recommendations regarding the quantity and type of PPE. On the homepage, you can select this tile to access the latest news on the pandemic. By clicking on the Learn More, you can view the number of new cases and the trend of COVID in 2020 in your state, which is incorporated into our app by passing CSV data from the Australian government using Node RED. You can also click on the graph to be redirected to more relevant news articles. Use the back button to return to the homepage, where you can click on more features, such as PPE supplies. Here you can select your desired PPE from the graphic, for example surgical face masks, and we will provide information on how to wear the PPE properly. For the general public, however, limited access is granted to certain supplies like respirators, as they will only be required by medical professionals. You can order various sizes and quantities of PPE and proceed to checkout.
Returning to the homepage, the PPE needs tile will allow you to track the status of your order. You also have the option to check the current stocks for each PPE using the stock inventory tile. Click the names of the particular PPE to visually see this data on a gauge, where red indicates critically low quantities, yellow moderately, and green extremely high quantities. There are also options to access your state's government's current guidelines via the Guidelines tile, which displays images and text, directing users to the links provided on rules and health information. You also have the option to contact us with any queries or send us a message that will be quickly reviewed by one of our friendly staff. A settings button can be found on the top left corner of the homepage that, when clicked, allows you to toggle on and off features. You can also change the display text size, edit your details, send feedback, and sign out.
Our implementation is split into 4 stages. Stage 1 is market research. This stage is focused on healthcare professionals and PPE suppliers, allowing us to select a pilot group to test nationwide. The app at this stage will only be available in the 3 most spoken languages as per census data. Stage 2 is a rollout to the general public. Numbers from COVID-Safe can be used to gauge user demand, given a similar publicity campaign. There will be a focus on addressing user feedback effectively. Stage 3 then releases the app to all healthcare professionals and PPE suppliers across Australia. We expect to initially need increased technical support throughout this period. The 4th stage is beyond the current pandemic. The app will transform to feature more general advice on hygiene and endemic diseases. A constant baseline of technical support is expected.
We've separated the implementation of pathogeny into 4 stages. This maximizes our chance to understand our user demographic as well as receiving a detailed feedback on the experience while using our app. These data will allow us to allocate appropriate technological and human resources, such as implementing updates and amend bugs to offer the best user experience with our product. The accessibility of pathogeny is a top priority for our team. We have implemented many features that compensate for the whole community. We are actively taking steps to ensure that our app can benefit everyone in the community, and thus optimizing the effectiveness in reducing the consequence of COVID-19. Overall, our product optimizes the distribution of limited PPE supplies, thereby maximizing the safety of health professions and public in times of global pandemic.
Good afternoon, judges. I'm Vanmeg, and this is my teammate Rahul. We are presenting an idea for the 3rd track, innovating better technology to prevent or minimize infection. Our problem statement is that with the growing number of COVID-19 cases internationally, mankind has to overcome the challenge of defining their new normal and hence resume the normal lifestyle. Our solution to this problem, smart masks, will be equipped with IoT breath sensors and will help schools, malls, public areas to resume work. Smart masks will come with a customized breathing sensor that is also an IoT device. Using a mobile application, the location of the IoT device is tracked and users can be notified to bring the mask to public places and to wear them at all times. We provide a B2B and a B2C service to suit all customers. The mobile application is also customized to support both environments. The masks will be on sale and on a subscription model.
Welcome to the application prototype created on Figma. So as we scan our mask and choose our individual account, we come to the home page where the pie chart displays the data on how often and how long the mask is worn, and the map shows the location of your mobile and your mask at all times. Then with the menu bar button, you check your profile where your personal details are stored. Next, when we choose the family head account type, we are welcomed by the same home page. But this time, the menu bar is different. While the profile button has the same functions, the family button shows you the family members that have smart masks and those that allow you to access their location. You can add members. Once he or she accepts your offer, you can check their profile, location, and mask location too. For the business account, you must first set your company building location on the map, where then you can look at the number of people in the building and notify those in red to wear their masks and those in purple to maintain 6 feet distance. Our team's strength is that we have a strong brand vision of the product as a lifestyle tech product, and that the core members are enrolled in University of Sydney and VIT, the best universities of Australia and India respectively. However, we do not have a team of skilled IoT and biotech specialists, which can be a weakness. Our opportunities are that we are releasing the product with the right timing, with no direct product competition, and the growth is promising. However, big conglomerates like Apple could start working on similar products which could become a threat. But I still believe the market is so big that being the first comer would still reward us with loyal customers. We are targeting to first sell the product in Indonesia due to its rising cases of COVID-19, and so are benchmarking the data with smartwatch market in Indonesia. 2.5% of Indonesians have smartwatches, out of which 23% of them wear it for fitness purposes, which means that 1.495 million people are ready to spend about $100 on a tech lifestyle device in Indonesia. If the smart mask manages to attract even a mere 2% of those 1.495 million people to buy our masks, and 10% of them to have it on a subscription model, then about 180,000 Indonesians would use our product. To conclude, if our product gets a steady increase in the influx of customers for a year after the first MVP of a working product, as shown in the table, then we can hit $3.8 million in revenue, with a $2.16 million cost, leaving us with a profit in the first year of $1.71 million. And the only investment we need is the right resources to gather the right team. Thank you.